welcome to an EMS update. This update will include information about the novel coronavirus disease 2019. My name is Lindsay Simpson. I'm an educator with the HealthNet Critical Care Transport Team and a paramedic.
My name is Michelle Greason, and I am a critical care transport nurse with the Health Network team, and I also take care of infection control for our team.
My name is Doug George. I'm an emergency medicine and EMS physician with the University of Vermont, and I'm the Associate Medical Director for the Vermont EMS District 3.
So what are we going to cover in this presentation? We'll discuss what COVID-19 is. We'll talk about what we know about the virus and its distribution at this point. We're also going to talk about clinical presentations you might expect to find in patients. We'll discuss PPE recommendations as well as patient transportation recommendations. We'll talk about ambulance hygiene and decon, as well as hand hygiene and a few pieces of additional information. You'll notice at the bottom of some slides it says references are in notes. All source material for this presentation can be found with each individual slide as well on reference slides at the end of the presentation. So what's happening in Vermont? At this point, we have one known case of COVID-19 in Vermont. Approximately 300 people are currently under surveillance for COVID-19, and they are known as a person under investigation, or a PUI. This does not mean that the patient is under quarantine. These patients are self-monitoring at home. They are taking their temperature twice a day, and they report in if their temperature goes above 100.4 degrees Fahrenheit. They're assessing themselves for dry cough, shortness of breath, runny nose, or fever. So what is the coronavirus? So COVID-19 is the disease caused by coronavirus, and the coronavirus is part of a large family of viruses. So this is the same virus that causes the common cold, as well as SARS and MERS. So coronaviruses are zoonotic, which means they can be transmitted between animals and humans. The transmission of a coronavirus from animal to human is known as a novel coronavirus in humans, and it's extremely rare. In fact, it's only occurred a handful of times in the last 50 years. It spreads through primarily respiratory droplets, and the symptoms will range from mild to severe. The symptoms may appear 2 to 14 days after exposure. So some of the signs and symptoms for COVID-19 include upper and lower respiratory infection, a runny nose, headache, cough, dry cough, sore throat, shortness of breath, and a general feeling of being unwell or general malaise. The patient may also have a fever greater than 100.4 degrees Fahrenheit. So this sounds like the flu. Similar to the flu, COVID-19 is transmitted by respiratory droplets. So these respiratory droplets come from the mouth or nose. So it may also be airborne, which means it would be suspended in air and dust. We also find COVID-19 on fomites. So fomites are objects or materials which carry infection. So when somebody coughs, the respiratory droplets from their respiratory tract will then land on surfaces, and that virus may survive on that fomite for up to a week. So what that means is that if a patient coughs in their hand, touches their doorknob, drives their car, touches their steering wheel, those respiratory droplets are still infectious for up to a week on that doorknob and that steering wheel. That means that EMS providers have to be really careful about cleaning doorknobs, countertops, cell phones, steering wheels, ambulance door handles, patient compartment bench seats, anything where a patient who may have COVID-19 coughs and that respiratory droplet lands on that surface. So in the rational use of personal protective equipment for coronavirus disease 2019, this is a publication that the World Health Organization put out in late February 27th, we quote, based on the available evidence, the COVID-19 virus is transmitted between people through close contact and droplets, not by airborne transmission. The people most at risk of infection are those who are in close contact with a COVID-19 patient or those who care for a COVID-19 patient. What do you do if your patient presents with flu-like symptoms? Well, you must ask all patients about recent travel. You should ask if they developed their symptoms in the past 14 days, if they have traveled to China, Iran, Italy, Japan, or South Korea. You should ask if they've had contact with a person known to have COVID-19, and if they have a fever with severe lower respiratory illness without any other explanatory diagnosis, such as coming up positive for influenza, you need to don the appropriate PPE. If they answer yes to any of those questions, you need to wear gloves, gown, eye protection, mask, N95, or other respiratory droplet protection. If you are going to come in contact with respiratory aerosols, you must wear an N95. This would occur when you are bag valve masking a patient or when you're doing CPR. Also, put a surgical mask on the patient. So COVID-19 is not found just in people who have been traveling outside of the United States. We are now seeing cases where patients are transmitting COVID-19 and they have not traveled out of the country. When you have these patients and you suspect COVID-19 or any respiratory droplet-borne illness, don the appropriate PPE, gloves, gown, eye protection, or N95 respiratory droplet protection, and put a surgical mask on your patient. So as of March 10th, you can see on the map on this slide, all the countries in blue have known cases of COVID-19.
Next, I'll review how to protect yourself at work. The two most common circumstances you'll come in contact with is one, if dispatch advises you that the patient is suspected of having COVID-19. If this is the case, be sure to don appropriate PPE before entering the scene. This is your gown, gloves, goggles, face shield, and respiratory protection. If you're using an N95, make sure it's the one you are spit tested for. If you're using a PAPR, be sure you're proficient in using a PAPR. If you are normally clean-shaven, you may need to shave more regularly to ensure the N95 mask has a good seal on your face. Also, place a surgical mask on the patient. If the patient needs a nasal cannula, apply the nasal cannula, then apply the mask over the nasal cannula. The second situation is if dispatch does not inform you that it's a potential COVID-19 patient. If that's the case and you are suspicious of a respiratory illness, if possible, initiate your assessment from at least 6 feet away from the patient. Put a surgical mask on the patient, and again, if you're using a nasal cannula on the patient, apply the surgical mask over the nasal cannula. It's also important to protect the driver. If at all possible, isolate the driver's compartment from the patient compartment. If you're unable to isolate the two compartments, the driver should continue to wear a mask or an N95 mask while driving. The CDC has provided some recommendations to protect the driver, which include creating a negative pressure environment in the driver's compartment. This is done by turning on the air intake in the cab and turning on the exhaust in the patient compartment, thus creating a negative flow of air through the ambulance. Also, if there is a door, close the door between the cab and the patient compartment. We've included a link to the CDC's guides for their recommendations. At HealthNet Transport, we've taken the option of draping the door between the patient and the driver's compartment. To do this, we use painter's tape first on the paint of the ambulance. Then we apply a 4 mil plastic sheeting with duct tape on top of that blue painter's tape. Our little takeaway from this is if you apply the duct tape directly to the ambulance surface, when you take it off, you risk pulling up the paint from the ambulance. Other transport considerations include the following. If the driver must be involved with patient care, the driver should don PPE with the crew and assist in care. When they are ready to drive, the driver should doff PPE in the correct sequence, perform hand hygiene, and then continue to transport the patient. During transport, the ambulance exhaust should be turned on and that recirculation should be turned off, making sure that there's fresh airflow coming into the driver's compartment. It is essential to limit the number of providers in the patient compartment. This will minimize possible exposures. During the transport of a PUI and the arrival at a hospital, it's important to notify the receiving healthcare facility. This will help determine the location for patient handoff. It might be in the emergency department or at the direct admit site or unit where the patient is going. Be sure to keep the patient separated from other people as much as possible. PUIs should ride with as few people as possible. Remember, minimal crew necessary for the safe transport of a patient should be in the back of the ambulance. If at all possible, family members and other patient companions should not ride in the transport vehicle. If family and/or friends are riding in the transport vehicle, they must wear a face mask. After transporting the patient, leave the rear doors of the ambulance open. This allows for sufficient air changes to remove potentially infectious particles. The EMS crew should remain in PPE until the completion of patient transfer. This should occur in this order. First, complete patient handoffs. Then the crew will doff all their PPE in appropriate sequence after the patient has been transferred. You will then don clean gloves to move the gurney back to the ambulance. And be sure not to let the gurney touch you or your clothing without PPE or a gown. When it's time for ambulance decon, start by pre-cleaning grossly contaminated surfaces. This is where you can use a towel or linen or paper towel, whatever you're using. You're going to get any piles of liquid or any standing liquid cleaned up first. You're going to do this and then apply your registered hospital-grade disinfectant to the frequently touched surfaces or the objects. Then, cleaning supplies should be disposed of in appropriate containers. Follow standard operating procedures for the contaminant, which would include trash goes in the trash bin, pharmacy waste goes into a black med bin, sharps go in sharps containers, and regulated medical waste goes in a biohazard bag. That's going to include your saturated dressings, saturated with bodily fluids. And of course, avoid shaking the linen. Lastly, hand hygiene. Your hand hygiene should take at least 20 seconds. Use the same technique whether you're using an alcohol-based sanitizer or soap and water. If possible, soap and water is preferred if available. On the right-hand side of the slide, you'll see the sequence of appropriate hand washing.
Next, we'll discuss special considerations, general circumstances at home, at work, as well as some administrative and logistical issues surrounding COVID-19. We must discuss the precautions for aerosol-generating procedures during patient care in the back of the ambulance. The first question is, what is an aerosol-generating procedure, specifically to EMS? Simple maneuvers such as bag valve mask ventilation or oropharyngeal suctioning, also therapies such as nebulizer treatments, or more advanced procedures such as endotracheal intubation or the administration of CPAP or BiPAP, and lastly, CPR can all cause aerosols to be generated that might carry COVID-19. Because of this, BVMs and other ventilatory equipment should be equipped with HEPA filtration to filter expired air. In addition, this is an especially important time to wear an N95 mask while these procedures are being implemented. Probably one of the most important concepts is to understand when you as the provider is truly exposed. Simply transporting a patient who's at risk for or has COVID-19 while wearing the appropriate PPE does not mean that you were exposed. An exposure may occur in these situations if the PPE fails. For example, a patient sneezes or coughs in your eyes or open an uncovered mouth. Furthermore, maybe the patient's bodily fluids splash into your eyes, nose, mouth, or unprotected wounds. Importantly, one should not go to work with unprotected wounds, but should be cautious to make sure that you could adequately protect any open wounds. Furthermore, the standard breaches in your normal PPE would also be considered an exposure, such as needle sticks or tears in your equipment, such as masks or gowns. Overall, it's very important that we think about how to prevent transmission, not just at work, but at home, and not just for COVID-19, but for other infectious diseases. So doing simple things like avoiding close contacts with people who are sick. Furthermore, avoid touching your face, especially your eyes, nose, and mouth with your hands. In addition, if you're sick with anything, not just COVID-19, please do stay at home. Cover your cough or sneeze with a tissue, and please remember to throw that tissue away in the trash. Lastly, please clean and disinfect frequently touched objects using household cleaning spray. And I don't think we need to say it that many more times, but please do wash your hands. Moving on to a different topic, more the administrative and logistic aspects of COVID-19. EMS agencies should consider developing policies for assessing exposure risk and management of EMS personnel who have been potentially exposed. Decisions for home monitoring, leave from work, or other public health actions for healthcare providers with potential exposures should be made in consultation with state or local public health authorities. EMS personnel who have been exposed to a patient with suspect or confirmed COVID-19 should notify their chain of command to ensure appropriate follow-up. More in depth, we want to examine the importance of the R value. This concept is very important while we monitor the viral transmission of any given infection, specifically viruses. R null is the average number of people that an infected person transmits the virus to. So when the R value is less than 1, an epidemic will eventually burn out. When R value is equal to 0, an epidemic will continue to transmit at a steady pace. And when we see the R value being greater than 1, the epidemic will continue to increase exponentially. Current estimates for COVID-19 have the R value between 2.5 and 2.9. The R value is a reflection of both the inherent properties of viruses and human behavior. Most importantly, the R value is a modifiable value which can be improved by proper PPE use and implementation. By improving R values via PPE, we can decrease the transmission of infectious diseases. Additional information to take away and hopefully share with providers and patients would include that 80% of those infected with COVID-19 currently do not require hospitalization. Once again, hand washing is the most effective method of preventing transmission of infectious diseases, including COVID-19. While the R value for COVID-19 is slightly higher than the seasonal flu, it is substantially lower than many other infectious diseases that you've all learned about. This is a current resource map from the CDC as of March 11th that assigns risk assessment levels for travelers specifically for COVID-19. This can provide healthcare providers with valuable information while establishing patients' travel history. This is a QR code which can be used to link your portable devices to the most up-to-date CDC travel risk assessment for COVID-19.
And to wrap up, the best protection is prevention. Please don't come to work sick. Wash your hands frequently for at least 20 seconds. Protect yourself on EMS and interfacility transport calls with gown, gloves, eye protection, and respiratory protection. Practice good hand hygiene. Notify the receiving facility prior to arrival so your patient can be triaged appropriately, and always decontaminate your ambulance. We hope you've enjoyed this update about coronavirus 19, and we have references in the order of appearance on slides on the next 2 slides. Thank you very much for your time and attention.